Hi, John Parrillo and Heather here. She's who you talk to when you get on Facebook, and she answers the phone. And she was getting ready for a contest, and she got all healthy, really feeling good, and ended up, she felt a little bit too good, huh? Because her and Kenny are now expecting their third kid, and this is another girl. She has 2 girls, and she has the most beautiful looking kids you've ever seen. So it was just like her day.
Yeah.
Now, she has a medical condition, so before we're going to show you some of the things she's doing. She's checked with her physician. The physician says she's fine, she can do this. Her doctor is actually very happy with her because with her first child, she went up to 199 pounds. And would you gain 70 pounds with that one?
Mm-hmm.
She's only gained, what, 15?
12.
12 with this one.
12.
So she's just, this is about the perfect pregnancy, and she's doing real well. She's taking all her supplements, doing real good, but everything is under the doctor's supervision and getting me okay. So now, when you're pregnant, now I wouldn't know what that's like, but you girls out there, you still want to work out and you want to get in shape as quickly as possible when you're done. Now, you can do your arm movements, your bench presses, your back workouts. The hardest thing to do is how do you work the legs and still get a good leg workout? So we're going to show you some of the things that Heather does with her doctor's okay. In fact, he thinks this is great. She's really staying in shape on this one now, as well as not going to the fast food restaurant. She's eating her bodybuilding meals, and everything is just going perfectly. This time we hope the baby will be as perfect as the other 2, right?
Yep.
Look just like her dad.
Yeah.
So one of the things now, you still want to keep your legs in good shape, because when you're after you deliver, that's one of the things you want to be able to get back in shape as quickly as possible. So of course you don't want to put the bar on your back and do squats. Remember, run all this through your physician, but here's what Heather does for her legs. You go through the squat movement. You can do it with no weights. You can do it holding on to something, but here's a good thing. Now, if you're going to stand on a platform like this so you can get all the way down, you don't have to go all the way down, but she likes to go real deep in her squats. Make sure if you get on something, it's not going to kick over. She actually uses the belt squat platforms here because they can't kick out. So don't get up on chairs or something and kick the chairs out. Do not. So these are things we're going to show you to do that are very safe. Make sure you're not going to injure yourself. Okay, so nice and deep squats. Notice her back is staying lined up. She's not really stressing her back. She's still working her legs, and she's still going through a full movement. She goes fairly light and does a lot of reps, right?
Yep.
She's staying in shape because actually, when are you getting in your contest?
October.
And that's how many months after you're supposed to deliver?
4.
4 months after you deliver, she's going to get in a bigger competition, right?
Yes.
So how many sets and how many reps you usually do with the squats?
4 sets of 15.
4 sets of 15 with 30-pound dumbbell?
Mm-hmm.
Okay, so this takes place of the squats. You're not putting the weight on your back. You're not levering forward. She's able to go straight down, keep her back in alignment. So this is a good thing. She gets up high so she gets up 6 to 12 inches off the ground so she can go nice and deep in her squats. So there's a good movement you can do, okay? What else do we need to do? Well, okay, here's the thing she likes to do. These are step-ups, and she puts some shoulder work in with it. So she steps up, does a shoulder press, step up, shoulder press, step up. You do the same foot or you alternate feet?
I same foot and then I alternate.
How many reps?
4 sets of 15.
4 sets of 15 with each foot. And she's doing shoulder presses with it. Okay, so Heather, she's over here all the time working out, staying in good shape, not, staying actually, although it's out here, she's staying actually fairly lean through the whole pregnancy, which is really good. It's much better than gaining 14 pounds and 70.
Oh, much better.
All right, here's another. Now, hamstrings are a hard thing to work. Sometimes Heather, I think, does do straight leg deadlifts, but you got to be real careful there. So if you can find a seated hamstring machine, like this Cyrex we have here. This is a good way to work hamstrings. Now you definitely can't lay on a lying hamstring machine. So go ahead. So here's a seated hamstring machine you can use. And another 4 sets of 15. 4 sets of 15. And keep your hamstrings in good shape. Okay? And then of course you can do your leg extensions. Another 4 sets of 50. Now you're not trying to do a killer workout here. You're just trying to stay in shape so when you do have the baby and it's just the perfect kid. And what's that score you give it?
100.
No. Isn't there a 1 to 10 score to give the baby?
No, they don't do that anymore.
They don't do that anymore. Okay. My daughter got a 10. She's got a 10. And when she's a teenager, I think she's got a 2. But now she's back up to 10. Okay, but so you do your extensions. Remember, squeeze at the top. That keeps your medialis muscles and your rectus femoris muscles in great shape. Or your vasti muscles, your medialis, lateralis, and medialis, and your rectus femoris in good shape. And then you can also do. Heather likes to do walking lunges. She does them with what, 10-pound dumbbells?
Yeah.
10-pound dumbbells, walking lunges. Just keep in shape. The most important thing is when you have your baby, then you're in fairly decent condition so that you can get back in shape a lot quicker and you haven't lost a lot of the muscle you usually worked so hard to get before you got pregnant. You don't just do nothing and then let everything atrophy. So I hope this can help you. Be sure to visit us at www.parrillo.com. Make sure you pass everything through your physician. And if you're pregnant, hope everything comes out perfectly and then you get right back in shape real quick as soon as you deliver. And in a couple months, nobody can ever tell you had a baby.